Hello and welcome to Health Assay. I'm your host, Amazing Tife. We can all agree that the year 2023 started on a very exciting note for everyone in the healthcare sector with the signing of the Mental Health Bill into law. Yes, this year, the President of the Federal Republic of Nigeria, His Excellency President Muhammadu Buhari, signed into law the Mental Health Bill. Now that the law has been signed in, what should Nigerians expect from this bill? Okay, so joining me as we share more light on this conversation is Funto Ogunbanwo. Funto Ogunbanwo is a clinical mental health therapist and the founder of Ibi Ayo, a mental health practice providing therapy services to those seeking support. Our work focuses on guiding and supporting individuals facing life transitions, self-esteem issues, depression, anxiety, and varying levels of trauma. Funto is a national certified counselor in the United States and has experience providing services across different settings such as partial hospitalization settings, residential treatment centers, and outpatient treatment settings. She also has experience providing mental health service and wellness workshops to several organizations. Funto has a bachelor's degree in psychology and communication from Houston College in Sherman, Texas, and a master's degree in clinical mental health counseling from Southern Methodist University, Dallas, Texas. Funto practices from a trauma-focused lens, and our goal with therapy is to provide individuals with a safe, non-judgmental, and collaborative environment that allows for insight, healing of hurts, and discovering the strength that lies within. So, hello Funto.
Hi,
It's
Sita.
nice to meet you again.
Yes, nice to see you too.
Okay, so let's introduce yourself, and then tell us why Lagos, why you decided to practice here in Lagos.
Okay, awesome. Hi everyone. My name is Funto Ogunbanwo. I'm a clinical mental health therapist and the founder of Ibi Ayo, where we provide, which is a private practice, a therapy private practice where we provide therapy services to individuals, adolescents, as well as couples, and we also offer services for organizations, so things like workshops, retreats, and the likes. So why Lagos? So I was born and raised in Lagos. I went to primary school, secondary school here, and when I was deciding where I wanted to, well, when I was deciding what I wanted to study, I landed on psychology, and while I was studying psychology, I really just started to see the gap that existed in mental health care,
Okay.
in Nigeria, and just like how there was like a lack of like quality services. So as I got into my psychology major and then also got my master's degree, it was always in the back of my head that okay, I would return back to Lagos to practice. But it was always like an eventual goal, like something that I would do eventually. But eventually came around sooner than I expected. But it's okay. So that's why Lagos.
Okay, beautiful. And it's very exciting news that the mental health bill has been passed, and it's like a long time coming. So let's go straight to the questions. So from your own point of view, what is the main provision of this mental health bill?
Yeah, so the main provision is that it replaces the 1958 Lunacy Act, which is the let me just read out what that is. So the 1968 Lunacy Act involves an involuntary admission of patients into asylums after a medical practitioner and a magistrate have determined that the individual in question is lunatic or insane. So basically, the provision, in my opinion, the bill, in my opinion, returns power back to individuals, right?
Okay.
So as I read out, the Lunacy Act, basically, if a practitioner or a magistrate decided that, okay, this person is unstable or insane, using the language there, you'd basically go into an asylum. Right? Which takes away your own freedom and infringes on your own rights as a patient receiving care. So the bill, just overrides that, where people now have power, people now have they have say in their treatment. In addition to that, there's a creation of a mental health department in the Ministry of Health, which would be great because there will be a department that is specifically focusing on mental health provisions. There's also provision for a mental health fund to be created, as well as banning discrimination that those with mental health challenges may face, especially when it comes to things like employment or getting housing and things like that.
That's good to know. That's beautiful. So how does the mental health bill aim to improve access to mental health care for individuals in this country?
Yeah, so I think with some of the things that I just mentioned, through the fund that's supposed to be created, but then also through community-based services, right? So the bill hasn't exactly fleshed out what that would look like, but I would hope that it would be something like outreach to communities, even just leveraging on like existing communities, things like existing public health,
primary health centers.
There we go. Things like PHCs, right? That already exist in communities. So I think to make things more accessible to everyone, it would be helpful if there was like a mental health avenue that was created in PHCs, right? Whether it's that like a psychiatrist comes monthly or just something like that, just like outreach that already exists within those communities, so that we can leverage on things that already exist versus trying to create new things.
Yes, and that's even going to be cost effective.
Exactly.
Yes. So,
exactly.
It's beautiful. Okay, that's good. So, can you discuss any potential challenges that this bill may face, during implementation?
Yeah, so I think just like with anything, when it comes to implementing bills, it's like creating policies that don't have people in mind, right? So policies that may sound great on paper, but in reality, it doesn't really, exactly, or like it doesn't really benefit the people. So for example, I think one of the downfalls would be if the services, right, if they're not well defined, or if the provision to get services is difficult for people. That's definitely one downfall. Another downfall would be putting ill-equipped people in charge. So people who maybe don't have like a public health background or also a mental health background, putting those kind of people in charge, that's definitely like a downfall that could arise with this bill, like the implementation of the bill.
Okay. So, let's talk about your experience as a mental health specialist or practitioner here in Nigeria. So, can you share us how it has been running Ibi Ayo here in Nigeria?
So it's been an interesting ride. Whenever people ask me that question, interesting is usually what comes to mind, and interesting in a not in a bad way, because I think sometimes when people say interesting, it's like, oh, it was bad. But no, it's just been an interesting journey. Definitely seen a lot of growth. Definitely seen a lot of people become more receptive to mental health and just therapy in general. So seeing a lot more young adults, which is kind of on trend. Young adults reaching out for services. So millennials and Gen Zs reaching out for services. But yeah, it's been an interesting ride. It's come with its own fair share of challenges, but I would say just seeing how people navigate therapy has been interesting, and just seeing like maybe some of the expectations that they may have around therapy has been interesting.
It's good to say that there's been more awareness.
Oh yeah, absolutely, way more awareness. I was just having a conversation with someone yesterday, and they were saying how like now it's not a thing of like shame to say that you're in therapy. Right, it's like everyone is open about it, or everyone is like, oh, maybe you should consider therapy, right? Whereas that hasn't always been the case. Previously, it was like therapy care, like should they do it? Like is it that deep and stuff like that? So there's definitely been a shift in like.
Yeah, the reason why I smiled when you mentioned Gen Z and millennials is like those are the people that are more receptive to therapy, unlike the older generation. Can you just speak briefly on that?
Yeah, so Yeah, so Gen Zs and millennials, those are the people that are more receptive to therapy, but the older generation is also getting there too.
Okay.
So
In Nigeria?
yes, I have seen older clients in
Okay.
Nigeria. I've seen people in their late 40s, mid to late 40s,
Okay.
people in their late 50s, almost 60s. So
Mhm.
people are getting there, and it's usually as influenced and encouraged by family members, right? So, which is why, like, although yes, we're seeing Gen Zs and millennials become more receptive in that they're coming for therapy more, but they're also encouraging, like, their parents or like older people around them to like check us out, you know. And when you are challenging mindsets or challenging like notions, right? So a lot of older people have like incorrect mindsets around therapy, right? And when you're challenging that, you need to do so gently. Okay. Right? Okay. So it's not just like, this older person doesn't understand therapy, right? You have to be empathetic and understand their own mindset and understand like what is influencing that mindset. And just like taking things easy, like, oh mommy, maybe you should try therapy, you know, but not in a harsh tone. Exactly. Or like insulting way, right? Okay. So yeah, there are people that are becoming more receptive.
And that's good to know. And what's the most common patient complaints or concerns that you've come across in your practice?
I'd say so I'm a trauma therapist, so I see lots of trauma. Unfortunately, I've noticed that like it's very common, which is very unfortunate. So a lot of people have experienced like abuse growing up, whether that's sexual abuse, molestation, or even physical abuse, and neglect. Yeah, it's very sad how common it is. So yeah, lots of trauma, also anxiety, and depression, and then just like yeah, work-life balance and overall just like mental health care, you know, dealing with like stressors of life of Lagos. So,
Okay,
yeah.
and can you discuss any initiatives or programs that Ibi Ayo is currently running or looking into?
Right. So right now we just leverage on our social media, right? So like if you wanted to learn more about something, what's the first thing that you're going to do? Social media. Yeah, exactly. So we're leveraging on social media by just creating content that educates people, but then also disrupt some of those like unhelpful mindsets or myths around mental health therapy. So that's what we focus on right now. Hopefully, as we grow along and you know, just continue, would also just branch into other avenues. Yeah.
Okay, so what about challenges? What challenges have you faced in your practice?
Yeah, I would say one big challenge is that people have um, some unrealistic expectations about therapy. Some people think that like therapy is something that you do maybe like 2 times, 3 times, and like you know everything is resolved, and that's not the case. That's certainly not how I work as a therapist. I understand that there are challenges that come with like um, continuing therapy on a long term. But just like with anything in life, if you want to see long term and lasting change, you have to commit to it, right? Okay. So, like for example, if somebody were trying to get into shape physically, right, or to improve their physical health, right, it's unrealistic, and if they're doing this through like the gym, it's unrealistic to expect that after 2 or 3 visits to the gym you would see changes, right? Okay. Even if they were doing it through their diet, right? I mean, we've seen that yes, there are lots of these like short-term fixes that would promise you that oh, in 5 days you will lose 10 kg. Okay, no problem now. After those 5 days, what happens? You gain it back, right? So it's the same with therapy. If you want lasting change, you can't expect that, you know, within like 3 to 4 sessions, like, oh, everything will be resolved. I like to tell people to think about it this way. A standard therapy session is 1 hour, right? So if we've met for 3 sessions, We've
That's
just
three
spoken for
hours. 3
3 hours.
hours, yes. Yes.
Just three
3 hours.
hours. You know,
Okay.
so that's definitely a challenge that
Challenge.
you know
Okay.
I
So what do
encounter.
you think people can do to, change their mindset regarding this belief system when it comes to therapy?
Yeah, so I think one, just come in with an open mindset. Two, be committed. And I know that like there are different things that can hinder commitment, right? I mean, one thing is just finances, right? Because we all know what the economy is doing, right? So there are things that can hinder finances. There are like time constraints or like schedules that can hinder commitment, right? And at the same time, if you we all know how we work as humans. If we really want something,
You
we'll
go
make
all
it
the
happen.
yeah, you go all the way out to get it.
Exactly,
Yes.
exactly. Right. So I would say be committed, be realistic, just check some of those like unrealistic expectations, um, and ask for support, right? So let's say if finance is a big challenge for you, right? If someone needed help with like their physical health, for example, like if they had to go to the hospital and they needed like financial support,
Yes.
they would probably reach out to like
Someone.
family members or just someone, right? It's the same thing with therapy too. You can ask for support. You can save towards therapy. Just because you can't afford it right now doesn't mean that like, oh, you should never consider it, right? You can save towards it. So
That's beautiful. And so how can people reach you? How can people reach Ibi Ayo?
Yeah, definitely. So you can reach us through the website www.ibiayo.com. So that's ibiayo.com. You can also follow us on Instagram. That's ibiayo. Ibi.io. So it's ib two i's ibii.ayo on Instagram, and then on LinkedIn as well. It's just ibiayo. So two words. But yeah, that's the best way to get in contact with us.
All right, thank you. That's been beautiful having this conversation
Absolutely.
with you.
Thank you too.
And then we look forward to greater things and achievements from Ibi Ayo.
Yeah, thank you so much. I
Thank you.
appreciate that.
Okay.
And there you have it, all said by the clinical therapist and founder of Ibi Ayo. We hope that stakeholders in charge of this mental health bill are paying attention and will put into consideration all that has been said on today's episode of Health Assay. Now, this brings me to the end of today's episode. If you've enjoyed it, please remember to give it a like and also share. You can also leave a comment, okay? And don't forget to subscribe, okay? And you can always also follow me on social media at Amazing Tife. Until I come your way again on the next episode of Health Assay, cheers and stay safe.